Okay, so I want you to start by just taking a few steps toward me. So start a little bit, a few steps back. Yes, and take a few steps toward me. Okay, good. I'm just trying to assess your gait to see if any of the issues in your deltoid that you told me you've been having, if they're stemming from your leg muscles or your hips or your obliques. So go ahead and turn around and walk a few steps. Okay. Okay, and does the pain radiate down to the center?
Yes.
Okay, so why don't you go ahead and face me. I'm not seeing any misalignment of your gait. I'm not seeing pronation of the feet. Everything looks to be symmetric in terms of where your hips are aligned and where you're holding your leg muscles. So come just a step forward, okay? I'm just going to ask you to do a few simple movements.
Okay.
So if you could, just very gently, as far as you can go, don't hurt yourself, but touch your hand to your knee on this side. Okay, try to hold that. Okay, I'm just going to palpate the sides of the spine. See if anything's popping out from the strain. Okay. Okay, and go ahead and do the other side if you can. Okay. All right, so that looks to be pretty even. Go ahead, take a step forward. Okay, good. Now face me again. Okay, just a few simple movements with your neck. Try to touch your ear to your shoulder, just gently as far as you can go. Okay. Any pain there in the neck when you do that movement? No? Okay, the other side. Okay. I'm not seeing any muscle protrusions, which is a really good sign. It seems like you are having some inflammation though. Okay, all right, so next I want to check just the bottom of your feet and your knees. So do like a lunge pose for me, very lightly. Don't spread your feet too wide, and just a slight bend to the front knee. Very good. Okay, so go ahead and apply as much pressure as you can to that front knee. I'm just palpating the kneecap to see if there's any kind of misplacement or descension of the lower calf. Nothing that I see. No weakness in the knees. The start of osteopenia or osteoporosis a lot of times is apparent in early stages in the kneecap, and everything feels very sturdy. Okay. All right, go ahead and switch. Okay. Same here. Okay, I'm just going to palpate the shin as well. And let me know if you feel any pain, okay? All right, symmetry is ideal here. Okay, so I think we can rule out dysplasia of the knee and the obliques. I think that your problem is really stemming from the latissimus dorsi and up to the deltoid.
Okay.
Okay, so I'm gonna go ahead and if you turn around, and I'm gonna palpate that area further in depth. So I'm noticing that your issues are not stemming from the cervical spine, but rather the thoracic spine and possibly the lumbar spine. So that's where I'm going to put my attention on. Okay, do you feel pain and inflammation here?
Yes.
Okay, that's T5 and T6. So I'm just going to palpate. All right, and if you could gently take your back hand and press it right here. I just want to palpate the scapula to make sure that there are no issues there. pain here? Yes. Okay. Your scapula doesn't seem to be inflamed. So again, I don't think it's coming from that region. I think it's more center. You can relax on the hand. And can I see the other? Okay. Okay. Your left scapula is protruding a little bit more than I'd like to see, which means it's going through some strain. Go ahead and relax your hand. Okay, I'm just going to keep palpating the spine. I'm going to do some quick measurements here. That's 10, 9, so definitely some misalignment in the thoracic region. 10. Okay. That's 8. Okay. Okay. Alright, I'm just going to do a few strengthening exercises to make sure there's no muscle loss. So I want you to push back against my hand with just your right side. Just twisting back. Good. Good. Now try to move forward. Good. Okay, pain doing that? A little bit. Alright, let's do the other side. So push back against me. Okay, push forward. And reaching out your hands straight. Okay. Try to move them outwards. Okay, and inwards. Good. Up and down. Alright, very good. Now try to move your elbows backwards. Okay, it's just your forearm forward. Alright, very good. So I think I've pinpointed the area I'd like to focus on. I'm going to go ahead and have you sit on the bed, and I'm going to just apply some gentle treatment to the top of the neck before we really get into the thorax, okay? Okay, alright. Go ahead and sit. Okay. Just going to apply some oil here. I'm just going to relax the cervical spine and the musculature here. I just want to get your trapezius muscles relaxed before we do the main work. Let me know if this is too hard, okay? A little bit of misalignment here at the top of the thoracic spine. Just want to get this spot. Is it okay if I move these straps just a little bit? Okay, thank you. Get your hair out of the way. Okay. And you're going to see some redness in the back. It should go away in a few days. This is just a good sign that your blood is taking in more oxygen and movement is occurring. Okay. Just going to do some tapping here. Okay, and some wooden tapping. So you're just going to feel some pressure points. Okay, so it's starting to feel a bit looser?
Yeah.
Great. I'm going to have you go ahead and get on the bed, face down, and just relax. I'm going to just use a variety of different tools and implements just to really get into that back area. Also be cracking your toes in your hands, okay?
Okay, thank you.
I'm going to start by applying some more oil to the back. Okay, and very gently, I'm going to use a very light wooden massage technique. This just spreads out the knots in those muscles. And always let me know if it feels too hard, okay? Okay. Should feel kind of cold. Going down to the obliques. Okay. And this wooden tool aligns perfectly to the curvatures of the muscles on either side of the spine. So it should kind of fit like a glove and feel like a release of tension. Okay, to work with the thighs. And this just aids in general alignment. Okay, and also an exercise that can realign the spine is tonal therapy. So I'm just going to be placing a tuning fork in different regions of the spine. You don't have to respond or do anything, just relax. It should feel like a nice vibration, okay? Really focusing on the thoracic vertebrae. This uses sound waves to penetrate deep within the spine. Just to reset your cell structure. Okay, very good. Okay. And I'm going to finish this section with some Thai medicine balls. Okay, this aroma will kind of linger on your back for a while after I use them. It should feel very relaxing, soothing, and it just adds another layer to the massage technique. Okay. Okay. And just a little bit more oil. Okay. Next, I'm going to just crack your toes to just give you some more oxygenation in the metatarsals and tarsals. All right. And okay, so just relax your feet. Okay. There we go. Okay. Okay, thank you. I'm just relaxing here. Okay, you can return it right there. All right, can I see your other hand? Perfect. There's a crack. Okay, so KCC, I think we're going to end it today. We were only booked for half an hour, but if this felt good to you, next time I'd like a longer session so I can do some deeper work in the tissues, okay? Thanks for allowing me to apply some healing techniques to your back, and I hope they work, okay?
Yeah, thank you.
All right.